What's up, everyone? On this video today, I'm going to discuss a little bit about, in the home care setting specifically, whether or not to use or how to use preparatory methods such as, heating pads, ice packs, etc. Have I used them before, and then what I recommend with that. Now, this is kind of a question that was asked to me on social media. Someone asked, kind of my thoughts on it, how I felt about it. Honestly, if it's safe for the patient and the patient responds well to it and seems to like it and they're cooperative with their treatment program, I definitely see no problem with it. Now, from kind of going through a few of the things that I use personally in home care, when I did some home care therapy in the past, my favorite thing would be using portable NMES units or portable TENS units. Both of those work really well because you can incorporate those into the movements or into the exercises, whether that's to kind of calm down some of the pain the patient's having while they go through the exercises or to try to make that muscle contraction more productive. I definitely like to use that. And the patients responded well to that because they kind of think, well, this is something, not just basic exercise. They've got some real medical, kind of a treatment thing that they're coming out with. So not only can it be beneficial to enhance the movements and things that you're doing, but then also you may get more patient buy-in, which we know that's important. You want to make sure that your patient's confident in the things that you're doing, the techniques that you're doing, because when I went into home care originally, a little bit, it's kind of like this predisposed, well, you don't have many things to work with. You don't have much that you can really do. And there really is a lot of things you can do. The therapists in that setting just have to become pretty creative. So I definitely like to use those. I also like to use massage guns or massagers. Now, with that, the percussive massagers, you have to be careful. A lot of people are very sensitive, have maybe they're on blood thinner and they can't take some of those more aggressive percussive massagers. One massager that I like, although it is percussive, but the head of this massager heats up and cools off. That's the Bob and Brad. I'll put a link in the description. There's also a link on my website, ChadGOrthoOT.com. You can go over the Amazon favorites section, click on it. You're going to scroll down and find that massager on there, so it's really easy to find. I also like the 10 to Global. So that massager does not percuss. It's just vibration. I really like that. And you can use that either throughout the session, you can use it prior to, or you can use it at the end. So if I'm using, say, a massager of some kind before a session, before we start our exercises, I kind of explain that to the patient that we're trying to provide that kinesthetic awareness, that sensory awareness, that body awareness to the tissue, to the joints, so that our movements are more productive and our brain kind of learns them a little better. And then if you're going to use it at the end of the session, then that's going to be more for, kind of like a reward. We're calming things down. That was a little bit difficult. Maybe I had some pain in the certain muscles of the area, and that's just, feels good for the patient at the end. So either way, they're more compliant to go through the program. You also can use those in the middle of the session. If this is a patient maybe has hemiparesis or something like that, where you're trying to facilitate those muscle contractions. So that works really well there. And so then kind of going down the line here, using heat or cold. That's very difficult to be able to do in a home care setting because you can't really keep ice cold, with you throughout the day. You can keep it in a cooler, but that's difficult. And then also with a heating pad, you have to wait for that to heat up. So if the patient has a heating pad and they're safe to use it, then maybe when I'm on the way, I give them a call. Hey, I'm headed that way. I'll be there in 15, 20 minutes. They'll go ahead and put the heat on, have that on before I get there. That way they're kind of primed and ready to go. A lot of times with ice or heat, I don't really care which one you use in most cases. And, there's a lot of, conflicting or back and forth research or opinions on whether ice is effective or heat is effective or what one is doing from a, histological standpoint, et cetera, et cetera. So just for me, I tell patients whichever feels better. If the ice feels better, the heat feels better, that's what we'll use. And again, you can just use it for either to kind of calm things down or make the patient feel better, like an analgesic effect, or you can use it to provide this sensory input, again, providing that proprioception or kinesthetic awareness type things as well. One of the things that I have done a lot in home health is joint mobilization. So gentle joint mobilizations, anything from a grade 1 to a grade 3 is typically pretty safe in home health. So I will do those, shoulder, knee, whatever area that is. And I typically would do that before we go through the movements, again, just to provide that input to the joints so that my movements, I feel like, are more productive and better. Although you can do that at the end. If you're doing like a little light massage, you can do a little joint mobilization at the end of the session just to kind of calm things down, modulate some of that pain and excessive muscle tone, and just kind of, leave with a less painful session at the end if it's something where they're having a lot of pain. So hope this video helps give you some ideas as far as using manual therapy or even modalities in a home care setting. I know a lot of times you have to be pretty resourceful because number one, you don't have a lot of time, and then two, you don't have the resources, and three, you might not have the space to be able to do some of these things, and the patient might not be able to lie down or different things to be able to do that. So you just have to get creative with it. At the end of the day, whatever works, get the results that your patients want and in a safe and effective manner. Thanks so much for watching, and we'll see you guys next time.